Symptoms of pancreatic cancer often do not appear until the later stages. If you experience jaundice or any other unusual symptoms, you should see a doctor. If someone in the family has already had pancreatic cancer, or if you have any of the risk factors and are concerned about the possibility of developing it, you should also speak to a doctor. They may suggest screening. Diagnosis: a doctor will ask about symptoms, take a family and medical history, and carry out a physical examination. They will probably also recommend some tests. Assessing symptoms: the physician will pay special attention to common symptoms such as abdominal or back pain, weight loss, poor appetite, tiredness, irritability, digestive problems, gallbladder enlargement, blood clots, deep venous thrombosis (DVT), or pulmonary embolism, fatty tissue abnormalities, diabetes, swelling of lymph nodes, diarrhea, stearia, or fatty stools, jaundice, atypical diabetes mellitus, Trousseau's sign, and recent pancreatitis may also be indications that pancreatic cancer is present. Laboratory tests: possible tests include blood tests, urine tests, stool tests. Blood tests can detect a chemical that pancreatic cancer cells release into the blood. Liver function tests check for bile duct blockage. Imaging tests: the doctor may request imaging tests to detect if a tumor is present, and, if so, to and see how far the cancer has spread. Common imaging tests include ultrasound or endoscopic ultrasound, CT, MRI, or PET scans, X-rays, possibly with a barium meal and angiogram biopsy. This can confirm a diagnosis. The doctor removes a small sample of tissue for examination under the microscope. Stages of pancreatic cancer: next, the doctor will assess the stage of the cancer, or how far the cancer has spread, to determine which treatment options are suitable. The stage depends on the size and direct extent of the primary tumor, how far the cancer has spread to nearby lymph nodes, whether the cancer has metastasized, or spread to other organs in the body. The stages range from stage 0 to stage 4. Stage 0, there are cancerous cells in the top layers of pancreatic duct cells. They have not invaded deeper tissues or spread outside of the pancreas. Stage 4, the cancer that has spread to distant sites throughout the body. At stage 0, effective treatment is possible. At stage 4, tumors have spread to distant organs. A doctor would only recommend surgery to relieve pain or unblock ducts. Treatment: cancer treatment depends on a variety of factors. The type of cancer, the stage of the cancer, the person's age, health status, and other characteristics. The individual's personal choices. Surgery, radiation, and chemotherapy are the most common treatment options. The aim of treatment is to remove the cancer, relieve painful symptoms. Surgery, chemotherapy, radiation therapy, surgery, and palliative care all play a role in the treatment of pancreatic cancer. Surgery can remove all or part of the pancreas. If the cancerous cells are still in one area, as in the early stages, it is possible to remove all of the cancer. The further the cells spread, the more difficult this becomes. This is why an early diagnosis is best for any type of cancer. The three main surgical procedures that can help people with pancreatic cancer are Whipple procedure, this most common if cancer affects the head of the pancreas. The surgeon removes the pancreas head, and sometimes the whole pancreas, along with a portion of the stomach, duodenum, lymph nodes, and other tissue. This is a complex and risky procedure. Complications include leaking, infections, bleeding, and stomach problems. Distal pancreatectomy, the surgeon removes the pancreas tail, and sometimes other parts of the pancreas, along with the spleen. Doctor usually recommend this procedure to treat islet cell or neuroendocrine tumors. Total pancreatectomy, the surgeon removes the entire pancreas and spleen. It is possible to live without a pancreas, but diabetes may result because the body no longer produces insulin cells. Palliative surgery. Palliative surgery is an option when it is not possible to remove the cancer in the pancreas. If there is a blockage in the common bile duct or the duodenum, the surgeon can create a bypass so that bile can continue to flow from the liver. This can minimize pain and digestive problems. Another way to relieve a bile duct blockage is by inserting a small stent in the duct to keep it open. This is a less invasive procedure using an endoscope. Chemotherapy. Chemotherapy is a form of medication that interferes with the cell division process that causes cancer cells to grow. As the medication travels through the body, it can treat cancer that has spread. Treatment occurs in cycles, so that the body has time to heal between doses. Side effects include hair loss, nausea and vomiting, fatigue. Combination therapies may involve different types of chemotherapy or chemotherapy with other treatment options. The chemotherapy drug that doctors most commonly use to treat pancreatic cancer is gemcitabine, Gemzar. The person usually receives it intravenously on a weekly basis. Adjuvant therapy is chemotherapy that comes after surgery. It aims to kill any cancer cells that remain. Palliative chemotherapy aims to improve an individual's quality of life in the later stages of cancer. Biologics are newer drugs that target specific parts of cancer cells. As they do not affect the whole body, they often have fewer side effects. One such drug, erlotinib Tarceva, has helped some people with advanced pancreatic cancer. The person takes it by mouth, as a pill. Radiation therapy destroys cancer by focusing high-energy rays on the cancer cells. As a standalone treatment, it can shrink a tumor or destroy cancer cells. Doctors may also combine it with other cancer treatments, such as chemotherapy and surgery. A person will normally receive radiation therapy for pancreatic cancer 5 days a week for 5 to 6 weeks. As a palliative treatment, radiation therapy can relieve pain or digestive problems when there is a blockage in the common bile duct or duodenum. The side effects include mild skin changes resembling sunburn or suntan, nausea, vomiting, and diarrhea, fatigue, loss of appetite, weight loss. Most side effects subside a few weeks after completing treatment. Treatment with bacteria. In 2013, scientists from Albert Einstein College of Medicine of Yeshiva University published findings of an experiment in which they used bacteria to carry radioisotopes commonly used in cancer treatment directly into pancreatic cancer cells. The results showed that the incidence of secondary tumors went down dramatically. The cancer was less likely to spread, compared with other treatments, and there was no harm to healthy tissue. If you like the video, please subscribe. Thank you.